Hey, welcome to what's covered under Medicare. And so I have a very big tip for you if you are new to Medicare or if you are been on your Medicare journey and thinking that you can say routine physical exam to your providers and get those covered for your medical coverage and Medicare coverage. And so, really big spoiler here. If you say routine physical exam performed without relationship to a treatment or diagnosis for a specific illness, symptom, complaint, or injury, guess what? Medicare, especially if you're under original Medicare A and B as your primary insurance, does not cover routine physical exams by statute or by law. However, the IPPE or the AWV, those are Medicare physical exam coverage terms that you'll use to coordinate your care for physical exams. And other Medicare benefits cover some elements of a routine physical exam. But if you say routine physical exam and you go ahead and get that physical exam done, the patient will pay 100% out of pocket. So your provider should tell you what is not covered if you say routine physical exam and you go in to get one and they're not, if they bill it and code it for a routine physical exam, it will not be covered. So that's a very big thing to note. And so if you are a patient listening to this, please educate yourself on the link I have below of this from cms.gov, which is the Centers for Medicare and Medicaid. This is the Medicare Learning Network, and this is their outreach and education under preventative services under the Medicare wellness visits. And so let's go back to what is covered. That's the Medicare physical exams coverage, and that's going to be the initial preventative physical exam, also known as the IPPE. And this is a review of medical and social health history and preventative services education. It's really important that you do this in the very beginning when you first transition onto Medicare Part B, because within the first 12 months, you get to coordinate your care specifically with the provider that you choose in your area that accepts Medicare, traditional Medicare, as some providers might call it, under Part B. To provide this IPPE. And guess what? The patient, as long as the provider accepts assignment, pays nothing. So that means you get your initial preventative physical exam, and then from there, you and the provider have the trust and relationship to know what is best or could be best for your medical condition or maybe underlying condition. If you've been on Medicare for a while, then you'll use the term annual wellness visit, AWV. So visit to develop and update a personalized prevention plan, a PPP, and perform a health risk assessment. If you are coming from Medicare Advantage, the optional alternative to traditional or original Medicare, then might be a term that you're familiar with, where they ask you a bunch of health risk assessment questions to try to determine your health risk, right? And so when you schedule an annual wellness visit, that is once every 12 months. So after you're on Medicare Part B for the first 12 months, that you'll use the annual wellness visit, and that is covered under Medicare. And from there, you and your doctor will coordinate your medical services and supplies to provide you the type of care that hopefully you are needing for your Medicare journey, whether it's in the beginning or in the later stages. So if you use the wellness visit, the annual wellness visit, the patient pays nothing if your provider accepts assignment. So it's very important to ask your doctor's office just initially, if you're brand new or if you moved into a different area, hey, does this office or does this your doctor accept traditional Medicare? And a lot of Medicare providers, clinicians, OTs, PTs, they'll know the term traditional Medicare as opposed to original Medicare. and that is what they'll typically know as, Medicare A and B as primary insurance. Okay, so I hope that has helped you guys out. Remember, the communication part of your Medicare medical services is very, very important, and it even states it on the CMS site here that for the providers that are listening to this, as a healthcare provider, you may recommend patients get services more often than Medicare covers, including the annual wellness visit, or you may recommend services Medicare doesn't cover. If this happens, please ensure patients understand that they may pay some or all the cost. So communicate this key to making sure patients understand that you're recommending certain services, whether Medicare pays for them. And me, as a Medicare insurance broker, I actually help you try to understand not only the coverage side, but also help you out with some of these terms, whether it be that you're trying to get some services ahead of time, like some people like to plan ahead of time, or if you got an EOB, aka a bill in the mail, and don't quite understand it, that's where our service, which is entirely free to our Medicare beneficiaries, to our Medicare savings members and policyholders, where we can do the due diligence to ask some of our experts in-house to be able to discern what is covered, what isn't covered, and possibly save you some frustration or hassle and headache while you're trying to understand what Medicare covers or doesn't cover for you. So if you do that ahead of time, that's probably best. But let's listen into this Medicare wellness visit video real quick.
Welcome to the Medicare Learning Network. This Medicare Wellness Visits educational tool gives an overview of Medicare's coverage of physical exams, including initial preventive physical exams, annual wellness visits, and routine physical examinations. The Initial Preventive Physical Exam, or IPPE, is a review of medical and social health history and preventive services education. It's covered only once within 12 months of Part B enrollment. For an IPPE, the patient pays nothing if the provider accepts assignment. An annual wellness visit, or AWV, is a visit to develop or update a personalized prevention plan and perform a health risk assessment, or HRA. It's covered once every 12 months. For an AWV, the patient pays nothing if the provider accepts assignment. A routine physical examination is an exam performed without relationship to treatment or diagnosis for a specific illness, symptom, complaint, or injury. Medicare doesn't cover routine physicals. It's prohibited by statute. But Medicare covers some elements of a routine physical through the IPPE, the AWV, or other Medicare benefits. For a routine physical examination, the patient pays 100% out of pocket. Use this educational tool to learn more about Medicare's coverage of these exams.
So guys, don't use routine physical exam as your lingo. Please use initial preventative physical exam if you're new to Medicare, or annual wellness visit if you've been on Medicare for a while and need to get a physical examination coverage where they can do a health risk assessment. And then from there, you and your providers can coordinate your care. So take care. God bless. I hope this has helped you.